Hi, good afternoon, all of you. Thank you so much again. And with a very short notice, we are able to have this session with one of the legend, Dr. Ravi Shankar Polishetty. Welcome, sir, on our platform. He is the founder and CEO of Sai Ganga Panikia. And when reading his profile, I was very motivated and very impressed, sir. He is a cardiovascular surgeon, he is a naturopath, he is a data scientist, and very strange, he is a Python programmer. So I'm very excited to meet you as well in person, and he's a scholar, well versed in Sanskrit scriptures, member of many associations, and I think he's having a cutting edge Dr. Polly, which he himself will brief us with the fundamentals of AI and machine learning being infused and incorporated in that. And a very significant event also will be going to happen tomorrow and day after tomorrow, and you all can see that event virtually live on our platform and other platforms. Our team will share that. And Dr. Sunita, again, thank you for connecting. And she is one of the leading anorectal surgeon from Hyderabad. So again, I will request Dr. Polishetty to please brief us about more about yourself, about the event in next few minutes, and so that we all can connect and make it forward in terms of developing our understanding about how AI ML when infused with the traditional fundamentals of Indian society and Indian culture, along with the modern medical science research, how it can benefit to the people. Thank you, sir, again for your time. Over to you, sir, and over to Dr. Sunita. Thank you.
Hey, thank you very much, Dr. Juneja ji. I'm so excited to be with you all. Thank you very much, Sunita, for connecting me here. Viewers, good morning, good afternoon. I'm so excited to talk to you all. See, I'm a cardiac surgeon, as as he was already mentioned. So what I tried to do, not now, but 32 years ago, when I started reading the allopathic version of medicine. So we stumbled upon several roadblocks there. Understanding the body as a whole was a problem. Number two was the pharmaceutical intervention. Literally scared me. I mean, that was an amateurish thinking at the time. I was just 19-year-old at that time. But then, I thought, I mean, if we block the receptors or agonize or antagonize them, you're going to end up with a lot of side effects. And then I was thinking, side effects are like one issue, but then, sometimes these medicines even cause death. And today, unfortunately, iatrogenic causes of death are leading at the number 3 spot. We have iatrogenic, which is doctor caused. By the way, I mean, this is not a Ayurveda versus allopathy debate at all, friends. I love Ayurveda. I super love allopathy. Both are required. They're two sides of the same coin, friends. Don't misunderstand at all my version at all. But what I did in the last 32 years is first 10 years I spent time on learning the scriptures in Sanskritam. Luckily, I was introduced to Sanskrit very young. I studied in Satyasai school. So I was introduced to the scriptures. And I tell you, this is a very, very advanced form of medicine, friends. Ayurveda is a very advanced form of medicine. So we talk about biochemistry in allopathy. Ayurveda talks about quantum and supra-quantum biochemistry, supra-quantum physiology. When we talk about receptor agonizing and antagonizing in pharmacology, Ayurveda talks about quantum modulation of receptors. Friends. These are like amazingly advanced concepts. And then to arrive at Ayurveda, you need to fast forward the modern science by 4,700 years, and then you will arrive at Ayurveda. So what we are trying to do is, so today, unfortunately, there is a debate Ayurveda versus allopathy, but that's not right at all, because what I figured was both, as I said, both are same two sides of the same coin. Number one, number two, the there is no common language of interface or working between these two professionals. Why? Because when you say vata, pitta, kapha, which form the fundamentals of Ayurveda, there's no correlational science or correlational physiological mechanism that explains these three concepts in the language of allopathy. So, and by the way, why are they important? Because samadosha, samagnisha, samadhatu malakriya, prasanna, atma, indriya, manaha, swastya ityabhidhete. So the fundamentals of Ayurveda are vata, pitta, kapha. But then these are not just three simple agents, friend. They're governing all the molecular, millions and millions of molecular pathways, metabolic pathways, under the influence of vata, for example, glucose, adopts a certain metabolic pathway. Under the influence of pitta, it adapts a different pathway, and under influence of kapha, the glucose, same molecule in blood, adapts a completely different metabolic pathway. So why is it so different? Is because this the vata, pitta, kapha are real, and what we did in the last 22 years was we created animal models of vata, pitta, kapha. We measured the action potential, measured the interleukins, and this is very, very exciting, friends. Because with which I understood the body as a whole with the help of this translational research. So the Vata Pitta Kapha, literally in the language of data science, they form those, you know, data separator lines. We don't have data separation. When you talk about diabetes, friends, different bodies talk about different guidelines. So starting from 5.5 being your normal, or 9.5 according to VADT trial, friends. So which one is correct, which one is wrong? According to which standard are you diabetic is the biggest problem today, and we have an answer for this. That's exactly why, that happened. That's possible only because I understood the vata pitta kapha in the language of modern biochemistry, and through this translational ayurvedic research. And through this research, we were able to map the metabolic pathways into the language of modern biochemistry, physiology. And not only that, we were the only ones. When what happens when you bring about samadosha, friends? Swasthya iti abhidete, spontaneous regeneration is possible. That was the hunch that I had. That was the intuition that I had. And you know what? We are the only ones in the whole world who have demonstrated total heart regeneration, total brain regeneration, kidney, liver, pancreas regeneration in experimental animals. And what we did was we translated all this knowledge into the bedside clinical methodology to address end stage diseases. And I bet, friends, 28,000 patients, with 63% of them are free from medicines today. And we're not, I mean, all are these end stage patients who had lost all life, heart failure, less than EF, less than 30%, diabetes, refractory diabetes. You talk about autoimmune disorders, end stage cancers. And friends, this is, as I said, when we recruit end stage, we are very conscious of the scientific guidelines given. So we don't violate any scientific guidelines. The first option is whatever is scientifically validated. I mean, by the modern science. I'm talking because I'm a MCI registered practitioner. I cannot go against the guidelines. So I insist that we go accept these standards and then build over that, and then generate more data. That's exactly what we did, because data speaks. Our whatever enthusiasm will never ever get through the scientific community. It's only the scientific data that's going to penetrate into the minds of the Western people. I mean, it's not just about the Western or the Eastern people, it's about the science. So what I discovered is this very, very algorithmic science. Ayurveda is a very advanced algorithmic science. So we then applied, derived these machine learning algorithms from Vata Pitta Kapha understanding of the body. And today, I see a lot of people talking about AI and ML technologies as applied to Ayurveda. Friends, I tell you that no one has modeled Vata Pitta Kapha, and they don't know what is Vata Pitta Kapha in the language of machine learning or in the language of artificial intelligence. So why? Because, friends, people usually, when they run the heart rate variability through a fast Fourier transform, it's a kind of feature extraction module. You kind of classify the heart rate variability into VLF, LF, and HF. And what is being supposed is that VLF is for Vata, LF is for Pitta, and HF is for Kapha, friends. No. In our animal model, we were able to find the VLF spectrum all over the spectrum. I mean, Vata frequency domains all over the spectrum. The Pitta are also spread wide. Kapha are also spread wide. It's only through animal model that we were able to pinpoint those 15 subdomains to different 15 subdoshas to 15 frequency subdomains. And that led to a very advanced form of machine learning technology that we came and that we bundled up into this device called as Dr. Poly. And we are hopeful that we're going to do a good demo tomorrow. And then it'll be very exciting because from this algorithm that I came up with, in the from AI, I mean, in the form of AI and ML, we're able to predict uh, blood biochemistry to an extent of 75%. We're not trying to compete. We're only trying to prove that this algorithm is right, that Vata, Pitta, and Kapha, they do exist, and we need to respect them for us to treat patients. So, friends, it's going to be very, very exciting. leave you here right now because I've got to catch up with a lot of other things. But see you all tomorrow. Ask questions. Let's have a healthy debate. This is the only conference where Ayurvedic doctors, allopathic doctors, data scientists, Python programmers, Sanskrit scholars, and top scientists from across the world are coming. A couple of parliamentarians, my friends, are also going to come from the Middle East, from the European Union, and from the United Kingdom. It's going to be a very exciting cruise, friends. 2 days of 10 workshops, all scientific discussions. Extreme panelists, both from the Ayurvedic community, allopathy community, are going to moderate the sessions, and they're going to correct me if wherever and where. It's not about correcting me or correcting anyone else, friend. We need to have this healthy discussion where we need to sit. Allopaths, Ayurvedic people, sit together, discuss the way forward. And I have come up with this common language of discussion, really gapping the bridge. Bridging the gap. Gapping the bridge also is important because we have too many bridges now in the form of WhatsApp universities. So we need to gap those bridges, bridge the gap that is between that's there between Ayurveda and allopathy people, and for which polyscientific Ayurveda is the way forward, friends. See you all tomorrow. Thank you very much.
Sir, thank you so much on behalf of Indian Vaidyas and from Ayurveda community. What you are doing is very inspirational, and no, we can't thank you enough. See you all tomorrow. We have 10 sessions, as you already told everything about the conference, sir. Thank you so much. Hoping
Thank you.
for the best, sir, in the field. Thank you so much. Thank
Perfect.
you. Sir.
Thank you very much. Thank you.
Thank you.